So I think, you know, at least a reasonable person is thinking that the president wants the Democrats to advance the plan, which is the 1,000-page bill, which is being offered by the Speaker and the committees that are under her authority. And that's what we were talking about tonight, because the president makes these assertions, and yet when you take a look at what's in the Pelosi plan, you start to see this disconnect between the two. And I think a lot of Americans have gotten that personally involved in this, that they have copies of the plan. They're starting to read it and saying, you know, the president's saying this, the plan is saying this, the president's saying this, the plan's saying that. And that's what I was trying to get at tonight. I mean, here's an example. There are those who claim that our reform effort will ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally. Okay, so this is what the president says. If you go to the bill says, this bill's not for illegal immigrants. So you say, oh, okay, that squares with what the president says. But then, when you look more closely, you find out that in the enforcement section, it says basically anybody can sign up for the deal. So there's no enforcement to put any teeth at all in this, which then makes you think, wait a minute, what's the smoke and mirrors? And so there's different ways to test this. One is to offer an amendment. So the Republicans offered this amendment. In order to utilize the public health insurance option, an individual must have his or her eligibility determined and approved under the income and eligibility verification system. This is fancy language to say you got to be a U.S. citizen, or you have to be here legally. And this, of course, is voted down on a straight party line vote. There were Republicans, 15 voted yes, total of 15, 26 Democrats voted no. Now this basically would say that not only are we going to say, no, illegal immigrants can't get this, but we're also going to say before you get it, you've got to prove your eligibility. And they said no. Now that leaves some level of confusion, but it clearly leaves the point that the Democrats did not want this amendment in their bill. And so this is that disconnect, but the president says one thing, and yet when you start to look at the facts, you go, oh my goodness, so what other way can you look at this? Well, one of the things we did, there's a congressional research. And we asked them, when you take a look at this bill, will illegal immigrants be able to take advantage of the bill? Now, this is a body that's not Republican, not Democrat. They're just a bunch of scholars. Here's the a quote from the Congressional Research Service, August 25th, 2009, just a couple of weeks ago. Under House Resolution 3200, that is Nancy Pelosi's health care bill, a health insurance exchange would begin operation in 2013 and would offer private plans alongside a public option. H.R. 3200 does not contain any restrictions on non-citizens, whether legally or illegally present or in the United States temporarily or permanently participating in the exchange. So these people are saying the same thing. When our constituents read the bill, bless their heart to wade through all of this stuff, they're saying it says there's no illegal immigrants, but in fact there's an amendment we offer to make it clear. The amendment's turned down on a party line vote, and there are no teeth in it at all. So there's this disconnect, and I think that's creating a lot of stress out there. I yield to my friend.
You've raised a really good point, Representative Akin, and I think you're right on that. And it's unfortunate that the president didn't really understand the ins and outs of the bill, or hopefully he wouldn't have said that. So I think maybe he wasn't as familiar with the ins and outs and details as what you're explaining right now.